The following is a conversation between Dr. Giovanni Traverso from Brigham and Women's Hospital and MIT in Boston and Denver Frederick, host of The Business of Giving on AM 970 The Answer in New York City.
Only about 50% of people take medication as prescribed. Some folks on long-term medication, well, they eventually just give up and stop taking it. This non-adherence could cost up to $100 billion a year in the U.S. alone. So this is quite the problem. But with us right now is someone working on the solution. He is Dr. Giovanni Traverso from Brigham and Women's Hospital and MIT in Boston. Good evening, doctor.
Good evening. Thank you so much for having me on the show.
So tell us about your research to address this problem.
Absolutely. As you highlighted, non-adherence is an incredible problem affecting over 50% of the population and translating into significant costs to the healthcare system, in excess actually of $100 billion per year here in the U.S. alone. And aside from the costs are the significant morbidity and mortality that are associated by, the simple fact that folks just don't take their medication. And one of the things that we recognize, and others have recognized this, is that making it easier for a patient to take their medication really increases the likelihood that someone is going to take their medicine. So let me give you an example. If a doc prescribes a medication that you have to take 4 times a day versus taking that same medication once a day, people are more likely to take it once a day than 4 times a day, just because it's hard to remember to take it 4 times a day.
That makes a lot of sense.
Exactly. And actually, there's some data out there also supporting that if you extend that a little further, that the likelihood of taking the medication also continues to increase. And so what I'm referring to is going from, for example, a medication that is dosed once a day to once a week and even once a month. Mm-hmm. And there are some medications where you can do that. There's only a limited number that exist in those formulations. And so what we set out to do was to try and develop a system that allowed patients to take their medication more infrequently. And let me just take a step back and tell you sort of a little bit about where we started this work. And several years ago, a team from the Gates Foundation came to visit us in the lab and then subsequently circled back to us with a challenge. And they said, it would be great if we had systems that allowed us to give our patients, for example, in sub-Saharan Africa, really resource-constrained settings, their full course of treatment in a single administration event.
Like for things like malaria, I would imagine.
Exactly, exactly. And you have to sort of put yourself in that situation. And, really what you want to make sure is that folks, on the ground in these really sort of limited settings have the ability to get the full treatment. And, the docs and other healthcare professionals there on the ground want to ensure that the patients are dosing themselves, correctly just to avoid any complications or antibiotic resistance, et cetera. And so that, working with the Gates Foundation, we actually set out to address this. Mm-hmm. And so what we did was develop a capsule that can stay in your stomach for a prolonged period of time. And by prolonged, I mean a week, 2 weeks, and perhaps even longer. And when you consider, regular capsule, when you take a regular capsule, you take it, and just as food, when you eat your food, that will go through your body in about a day.
Right through the pylorus and out it goes.
Exactly. And so similarly, a capsule, typically when you go to the pharmacy and you get an extended release capsule, an extended release capsule is for 24 hours. And that's really limited by a couple of factors, but one of those is just that our GI tract, our stomach, small intestines, and large intestine are actually fairly effective at transiting material through them. And so what we set out to do was really to explore different ways of sort of slowing that down and then allowing essentially a system to really deliver a drug over a prolonged period of time. Mm-hmm. And so the way that we did that was by developing a capsule that looks much like a star, but the capsule itself looks like any other capsule. But when that shell dissolves in the stomach, out pops out a star that is able to stay in the stomach without causing any obstruction or any symptoms. But that little star, the arms of the star, so the spokes of the star as such, are made of a polymer which is impregnated or loaded with a drug. And what happens is then that drug can slowly come out over whatever time frame it is that one needs to receive the medication over.
So if I get this right, you are warehousing the medicine in the stomach.
Exactly. That's exactly right. And so in order to prevent that star system to essentially be expelled out of the stomach, there's a couple of things that we had to work out in the lab. And so one of them was what's the best size? And what we know is that the exit of the stomach is about 2 centimeters. So we knew that a star had to be, over 2 centimeters when in the stomach.
Mm-hmm.
And then the other thing that really is really important is that the stomach is actually a really strong organ in that, it helps digest food and it really compresses material in the stomach. And so we had to develop some materials to withstand those compressive forces.
Mm-hmm.
And then what we built into this system are segments that are capable of dissolving either in the intestine in case it passes inadvertently out of the stomach so that it breaks up and doesn't cause an obstruction, or that can break up over time. And so you have a star that you can control how long it will live or reside, in the stomach.
Okay, I know that you have so far managed a 2-week diffusion, but we're working on increasing it to a month. How is that going?
It's going really well. We've actually managed to keep these stars without any side effects in our preclinical models, for over a month. And so, I think we're well on our way. I think it'll require more development. And, we really want to bring these technologies to patients. And as part of that effort, we actually started a company in 2015 called Lindra that is really focusing on bringing these technologies to patients and really building out all of the safety parameters and all of the data that's required by the FDA in order to safely, dose humans.
That's fantastic. And I would imagine, actually, the dosage that people are going to get is going to be even more even than the spikes we get when we take that daily pill or that multi-day pill. Would that be correct?
That's absolutely right. No, that's a great point. And because you have this system in your stomach slowly releasing, it's exactly as you pointed out. It gives you a much more even dose, constant dose. And so therefore, actually, you even in some situations, for example, you may need less drug because you're able to provide this continuous steady dose as opposed to the peaks and valleys that you might face when you're dosing a regular medication. And I think the other piece to that is that because it's there, for prolonged periods of time, any effects that sometimes are seen with food are really significantly removed because it's there all the time. And so, it's delivering slowly, irrespective of the food. And that really, as you highlighted, really provides a much smoother level of drug in the body.
We mentioned malaria before. Give us a few other things that this might be useful for.
Absolutely. So, we've been working on HIV and some other neglected tropical diseases. There's some parasitic infections that affect a lot of people, for example, in sub-Saharan Africa. And so a lot of our focus in the lab has been with the Gates Foundation on working on diseases affecting sub-Saharan Africa, Southeast Asia, for example. But HIV is another big area that we've been focusing on, and parasitic diseases also. And Lindra is looking at a whole host of different things, including psychiatric illness, problems with addiction. So really, I think there's a very broad set of conditions that can benefit from these systems.
It's truly a brilliant platform, and I know you don't have a crystal ball predicting what the FDA is going to do, but how soon do you think this might get to market and people in our listening audience might be able to take a pill like this?
That's a great question. So we're starting the first in-human trials this year in 2017. So as far as being on the market, likely in about 3 to 5 years.
That's fantastic. Well, this is very exciting and important research with some real practical benefits to just countless people out there. Thanks so much, Doctor, for taking the time to share it with us tonight.
No, thank you so much, Denver, for your interest in really sharing it with your audience.
The Business of Giving can be heard every Sunday evening between 6 and 7 p.m. Eastern on AM 970 The Answer in New York and on iHeartRadio. You can follow us at Biz of Give on Twitter and at Facebook.com/businessofgiving.